Watch and lose weight. The Watch and Lose program is a simple and effective way to learn about the harmful effects of overeating on the body and mind. The program is grounded in the science of motivation and uses pain to motivate you to avoid overeating. Motivation can be described as the driving force that compels individual to take action or pursue a particular goal. That's what makes the individual move towards something desirable or avoid something painful. Pain and pleasure are two powerful motivators that can impact an individual behavior. Pain is often a more immediate and pressing concern than pleasure. When we experience pain, our body and mind prioritize finding relief from the pain above all else. This can lead to a stronger sense of urgency and motivation to take action to alleviate the pain. In this program, we use pain to motivate you to avoid overeating. Some information about the harms of overeating will be repeated several times in the program to make sure it affects your unconscious mind. Please tolerate a moderate painful emotions as you listen, because the whole purpose of this program is to program your mind to associate pain to overeating. When you eat food, several complex processes occur in your body to digest and absorb nutrients. Here is a brief overview of what happens in your body when you eat food. Mouth. The process of digestion begins in the mouth when you chew your food, and the enzymes in your salvia start to break down the carbohydrates in the food. The chewed food is then pushed down the esophagus and into the stomach. In the stomach, the food mixes with digestive juices and enzymes that help break down the food further into smaller particles. The stomach also secretes hydrochloric acid to help kill any bacteria that may be present in the food. Once the food is broken down in the stomach, it moves into the small intestine, where nutrients such as carbohydrates, protein, and fats are absorbed into the bloodstream through the walls of the intestine. The small intestine also receives digestive enzymes from the pancreas and bile from the liver to help with the digestion process. The remaining food particles that cannot be digested move into the large intestine, where water is absorbed from the food to form solid waste products. The solid waste products are then stored in the rectum until they are eliminated from the body through the anus during a bowel movement. Overall, the process of digestion is complex and involves several organs and enzymes to break down the food and absorb nutrients. Each step is essential for the body to receive the necessary nutrients to function properly. Eating food can have emotional effects on the body, including changes in hormones level and brain activity. Here is a brief overview of what happens emotionally in the body before, during, and after eating. Before eating, the body may experience hunger, which is regulated by hormones such as ghrelin. Ghrelin is produced by the stomach and signals to the brain that the body is hungry. Low blood sugar levels can also trigger feelings of hunger and may cause the release of stress hormones such as cortisol. As you eat, the body may release hormones such as cholecystokinin and leptin, which signals to the brain that the body is full and satisfied. These hormones help regulate appetite and prevent overeating. The act of eating also triggers the release of dopamine, a neurotransmitter associated with pleasure and reward, which can create positive emotional feelings. After eating, the body may experience feelings of satiety and satisfaction, which can be accompanied by a decrease in hunger hormones such as ghrelin. Blood sugar levels may also stabilize, which can help regulate mood and energy levels. Dopamine is a neurotransmitter that's associated with pleasure and reward in the brain. Eating can trigger the release of dopamine in the brain, which can create positive emotional feelings and reinforce the behavior of eating. Here's how dopamine affects our eating behavior. Dopamine can create cravings for certain foods, especially those that are high in sugar, fat, and salt. These foods can trigger a dopamine release in the brain, which can lead to a feeling of pleasure and encourage further consumption of these foods. The release of dopamine can also create a reward response in the brain, which can encourage overeating, even when the body is already full. This can lead to a cycle of overeating and a greater risk of developing obesity and related health problems. Dopamine can also be released in response to stress or negative emotions, which can lead to emotional eating. When an individual is stressed or feeling down, they may turn to food as a way to boost their mood and trigger a dopamine release in their brain. In general, the feeling of pleasure or reward after eating due to dopamine release can last from anywhere from a few minutes to a few hours. However, it's important to note that relying on food as a source of pleasure or reward can lead to unhealthy eating habits and negative health outcomes. Overeating can cause discomfort and feeling of fullness because it puts a lot of strain on the digestive system. When we eat, the food is broken down by our stomach and intestines so that the nutrients can be absorbed into the body. However, if we eat too much, the digestive system may not be able to break down the food as quickly or efficiently as it should. This can lead to a number of uncomfortable symptoms. Indigestion and heartburn. Consuming too much food can cause acid reflux, leading to indigestion and heartburn. Overeating can cause acid stomach because when we eat too much, our stomach produces more stomach acid to break down the excess food. This can lead to an increase in stomach acid, which can cause a range of uncomfortable symptoms such as heartburn, indigestion, and acid reflux. When there is an excess of stomach acid, it can irritate the lining of esophagus, causing a burning sensation known as heartburn. This can be particularly uncomfortable when lying down or bending over, as the acid can easily flow back into the esophagus. Over time, the constant production of excess stomach acid can damage the lining of the stomach, leading to inflammation and ulcers. This can cause abdominal pain, bloating, and nausea, and can even lead to more serious conditions such as gastric cancer. Overeating can cause fatigue and laziness for few different reasons. When we eat a large meal, our body has to work harder to digest and process all the food. This can cause a temporary drop in blood sugar levels, as the body diverts energy to the digestive system. As a result, we may feel lethargic and tired after a big meal. In addition, overeating can also cause a release of insulin, a hormone that helps the body absorb and use glucose. However, if we eat too much, the body may release too much insulin, causing a sudden drop in blood sugar level. This can cause feeling of fatigue and sluggishness, as the body struggles to maintain its energy levels. Overeating can also lead to an increase in the production of a hormone leptin, which signals to the brain that we are full and should stop eating. However, if we consistently overeat, our body may become resistant to leptin, leading to a chronic feeling of fatigue and sluggishness.